Welcome again to my YouTube channel, and allow me to talk about one very common form of contraception that we refer to it as intrauterine contraceptive device, or the one that majority of you refer to it as COIL. Allow me to say that this is a form of family planning that offers protection against pregnancy to a maximum of 10 years. This form of contraception is divided into two. We have the hormonal contraception and we have the non-hormonal contraception. In hormonal contraception, this coil contains an hormone that we refer to as levonorgestrel, and in non-hormonal, this contraception contains the copper ions. In both of these, both the hormonal and the non-hormonal, they have different ways on how they work to prevent pregnancy. When we talk of the hormonal or the levonorgestrel, how this thing works, it works by thickening the cervical mucus, hence making it hard for the sperms to swim to reach the fallopian tube. Normally, the cervical mucus is supposed to be thin and slippery to make it easier for the sperms to swim to the fallopian tubes to fertilize the egg after every ejaculation. But when you get to insert this hormonal contraception that contains levonorgestrel hormone, the levonorgestrel hormone that is usually released every time or every day, it makes the cervical mucus thick, making it hard for the sperms to swim to reach the fallopian tube, and in that way, pregnancy is prevented. When we talk of the non-hormonal, the contraception that contains copper ions, how these copper ions works, every day, this coil releases the micrograms of the copper ions. So every time there is an ejaculation, these copper ions becomes toxic to the sperm that has been released, and hence kills the sperm cells even before they get to reach the fallopian tubes for fertilization. Now, in every advantage that anything has, there must also be the disadvantages of it. Allow me briefly talk about the advantages and the most advantages that are associated with this form of family planning. As a whole, it being the hormonal or the non-hormonal, they have the advantages that are associated with it, and also they have the disadvantages that are still associated with it. When we talk of the advantages of this form of family planning, number one is that they offer protection immediately after insertion. Unlike other forms of family planning, like for example, when we have given you a 3 months shot, we always advise that you wait for at least 72 hours before you engage yourself into sexual intercourse for this body to be compatible with the shot that we have given you. When we talk of the normal or the daily pills, we still also again advise that after you take these pills, you wait for at least 72 hours to make sure that the body has been compatible with the pills to ensure 100% protection against pregnancy. Now, unlike that, when we talk of these IUCD, it offers protection immediately after insertion. Another advantage of this coil is that it can offer protection of up to 10 years. So immediately after we have inserted this coil, you will not be liable to be getting insertions after every month or insertions after every day, because this one, the moment we have inserted it, you have started a journey of staying for up to 10 years without getting pregnant, so long as this family planning is in situ. Another very important advantage is that unlike any other form of family planning, this form of family planning is not associated with change in body weight. You understand that majority when they use maybe the 3 months shot, others use the 5 years injection, the 5 years implant, or the 3 months implant, or even the daily pills, majority will present with increased weight, and others even will present with reduced weight. So unlike all that, when we talk of this IUCD thing, it does not affect the weight, may it be adding of weight or the reducing of weight. Another advantage is that this form of family planning, it offers a wide range of protection against several kind of chronic conditions. Because in some of the hormonal contraception, they are likely to cause cancer of some organs and some other forms of diseases. Like for example, when you are prone into taking the daily pills that people take every day, you are most likely to suffer from forms of deep venous thrombosis, or in other ones, a condition whereby the blood clots into your blood vessels, causing a thrombi, that's what we refer to as the deep venous thrombosis. Unlike that, this form of family planning does not come along with such conditions like the deep venous thrombosis. It does not also come across along with issues with the high blood pressure, because majority, when you use the 3 months injection shot, when you use maybe the 5 years or the 3 years, when you use the daily pills, majority will also present with issues with hypertension. So that one is also one of the side effects that can be seen from other forms of family planning, but they are not seen in this form of family planning or the COIL. So those are some of the common advantages that are there when we talk of the family planning as compared to other forms of family planning. Of course, we have several other advantages that are associated with this. And another advantage is that this thing offers a slow release of hormones into your body. Like Ahen said, for example, when you insert the copper T, it releases a minimum of 20 micrograms of copper into your body every day. This one is unlike other forms of family planning pills. Now, having spoke of the advantages that are there, we also still have the disadvantages that are associated with this form of family planning. And one of the disadvantages that majority have suffered is an issue with the menorrhagia or the excessive vaginal bleeding. When we insert this form of family planning, in between, before it becomes compatible with the body and the body regulates itself to make sure that it responds to this foreign being in the body, majority will present with excessive vaginal bleeding. Number two, immediately after we have inserted this, we always expect people to present with vaginal spotting. How does vaginal spotting occur? This thing penetrates from the vagina, penetrates through the cervix, and then it attaches itself into the uterus. So after now the insertion, because of some of the laceration that might happen in the cervix, because during insertion there is an instrument that we usually use to clamp the cervix so that we can be able to insert the coil freely. Now, from that laceration that might occur into the cervix, that's how spotting occurs. In between, after now this coil has gotten into place again, it might also, in this or the other, it might also cause some lacerations in the walls of the uterus or in the walls of the fallopian tube where it will hang, and then in this or the other, it causes some lacerations. Another very big disadvantage of this thing is that when we insert you this form of family planning, then you are most likely prone to getting infections, because most of the people get infections during the insertion procedure. In case an hygiene was not achieved during the insertion procedure, then we are most likely to transfer bacteria into the vagina that may later cause infections. Another thing is that the moment you have this thing we discourage having multiple sexual partners. Because the moment you have multiple sexual partners, remember, when we insert this, we leave a small drain outside in the cervix, meaning this drain will be outside in the cervix and almost getting into the vagina. So when you get yourself into multiple sexual partners, and then in between one of them suffers an infection, then you are most likely to capture this infection. How will this infection occur? Remember in the previous video when I talked about the pelvic inflammatory disease, there is a E. coli bacteria or any other form of bacteria. It can ascend from the vagina, get into the drain that is left outside the cervix, and then it ascends through until it gets to the fallopian tubes, hence causing infections of the peritoneum, infections of the reproductive organs, and that's how you can have issues with the pelvic inflammatory disease. You can have issues with the peritonitis and the rest. So that one is also prone to infection if you are a person of multiple sexual partners. Another disadvantage of these is that it is most likely to come out, especially if it's inserted postpartum. Like after now you have suffered an abortion, or you have delivered few months or few weeks after that, and then this coil is inserted, then it's most likely to come out because the cervix is still ripe, the cervix is still dilated. So this thing can easily move out, or it can easily dislodge out, and then it will not be able to protect you successfully against pregnancy. Another disadvantage is that in the first 3 months after we have inserted this, during a menstruation flow, it's most likely again to dislodge. Within the very first 3 months, it's most likely to dislodge during the menstruation flow. Another disadvantage that I don't know whether I should put it as an advantage or a disadvantage is that it alters with your menstrual cycle. There are people who will keep on getting their menses very well. There are people who will completely miss to receive their periods, and there are people who will receive their periods on alternate days, and there are other people who will receive their menses every day. Now, I said I will not know whether it's an advantage or a disadvantage because there are people who enjoy getting their menses because it makes them be sure that they are okay, and there are other people who enjoys missing periods so long as they are sure they are not pregnant. So I don't know whether you put that point in advantage or disadvantage, but that one it's on to you to judge whether to you is an advantage or to you it's a disadvantage. But the point is, it causes issues with the menstrual derangement. So those are the most common side effects that are associated with this form of contraception. But the key thing is that in all the disadvantages and the advantages, this is one of the best family planning methods that you can use, because all other forms of family planning method, they have their own disadvantages that are not tolerable to most of the people. So any other time that you consider any form of family planning, I would advise that you consider having the intrauterine contraceptive device. And let me make this clarification even before I end this. In other forms of family planning, especially when we give you a 3 months injection shot, when you get used to this form of family planning, it keeps on lowering your fertility potential. Or in other ones, it lowers the chances of you getting pregnant very fast. You will still get pregnant, yes, but it lowers the chances of getting pregnant quick after you have stopped the injections. But one advantage with the coil is that you can get pregnant immediately after you remove this one. After you remove it, you are most likely to get pregnant immediately after you stop this form of contraception. So, and remember again, I say this one does not affect weight. This one does not affect your blood pressure. This one does not even affect your libido. Just like any other forms of family planning, they cause you to have low sexual drive. Many people using the 3 months, the 5 years, the 3 years, and the daily pills, they suffer decreased libido or decreased urge to have sex. But when you are using this form of contraception, it does not alter your sexual urge. So meaning you will continue to enjoy anything as you were enjoying them before. And then another myth that many people has is that they tend to believe that the string or the thread that is left after we have inserted this family planning causes discomfort during sexual intercourse. That one is a lie, because ideally we live like few centimeters from the cervix. After now we have inserted, we cut the thread a few centimeters, mostly 2 to 3 centimeters after, all far from the cervix opening. This means that no matter how deep you penetrate during sexual intercourse, you are most likely not going to reach the thread. So the point is that this form of family planning does not cause any discomfort during sexual intercourse, nor does it affect the husband or the wife. So as I said, if you are choosing any form of family planning, I would always advise, and this is something that I always advise my client, the very first thing to go, then you should think of going the intrauterine contraceptive device thing. So I welcome your comments, I welcome your likes, I welcome you to share this, and again, I highly welcome your subscriptions. If you like it, comment into the to the section below. If you have a question, ask it in the comment section, and I will address it as soon as possible. Until I see you to the next video, I sign out.